but it has maintained itself as an independent major state in the Middle East. That is absolutely intolerable to the US state. And Obama has not shifted from that at all. He's made a number of patronizing appeals to the Iranians, but now as he's in effect saying that the protesters should be allowed to control the streets of Tehran. Turn that around. What if it was suggested that protesters should be allowed to control the streets of Washington? But that's, of course, another side of double standards. I really don't believe anything has changed. And if it is going to change, if in the Middle East, as in other parts of the world, there has to be greater pressure from within the anti-war movement, within the peace movement, within all those groups that have allied themselves with the Democrats.
Renowned filmmaker John Pilger. Will continue with my interview with him in a minute. This is Democracy Now!, democracynow.org, The War and Peace Report, as we return to my interview with the Emmy Award-winning filmmaker John Pilger. John Pilger, you're not an American citizen, but I'd like you to comment on American politics. With the election of the certification of the election of Al Franken to be the 60th Democrat in the Senate, the Democrats have a supermajority. They can pass a filibuster-proof majority. They can pass anything they want. The question is, from foreign policy to domestic policy, what exactly President Obama will do with this. Primary on his domestic agenda is health care. You come from Britain, though born in Australia. What are your comments on how this debate is being carried out in the United States? More than 70% of Americans say they want a public plan. But it's pretty clear that even people within President Obama's own party are terrified, or at least getting millions of dollars from the health insurance and health care industry. Explain your system in Britain.
Amy, my impression gained over many years, and I don't think I'd call myself an honorary citizen, but I've certainly come to this country and lived in it for many years. My impression is that ordinary Americans are so far ahead of their politicians, so far ahead of their media, and so far ahead of all those who claim to be their betters and who bestow on them stereotypes that are almost contemptuous. Indeed, you can go back to Madison when he described the American public as at best meddlesome. I think if you look at the credible polls, say those done by the Pew organization, then you will see that the majority of Americans are very dangerously subversive. I would say that they may even be left-wing. This is a very worrying situation, of course, but the majority of them want the decencies. As you've suggested, they want a universal health care system. Now, I'm talking about two-thirds here. I think the figures I saw were 74%. They want their country out of the colonial wars that they're fighting, the various wars, Afghanistan and Iraq. They want the government to take responsibility for those who cannot care for themselves. They want the banks and the banksters, as Franklin Roosevelt called them, are brought to account. They have decent, I hesitate to call them radical views. They're not radical views. They're just the views of decency. But they're views at huge odds with their government, be it a Bush government or an Obama government, and their views are at odds with the media that claim to represent them, to be their agents, as it were. And to watch this so-called debate, it's not a debate, Amy, it's a farce. What Obama is moving towards is what Hillary Clinton tried to before she allied herself with some of the worst elements in the health insurance business. What he's moving towards is a very messy version of the old system that will allow the old pirates still to run it, that certain insurance will be guaranteed, yes, on a Medicare basis, but it will be a mess.
Could you explain, because it's so unusual to hear about what other systems are without them just being described as socialist, and so you end the discussion.
Yeah.
Interestingly, single payer in the United States, most popular option, and yet it is almost never mentioned in the media except by those who attack it. Canada has a system that where the government pays for health care. In Britain, the doctors are employees of the state. Can you explain how the British medical system works, and if it works?
Well, I've lived in the UK most of my life, and I've used the National Health Service. I regard it as a treasure. I regard it as I've had some of the best care for not particularly serious ailments, but I've had some of the best care that I could possibly have. What happens is you go to a GP, a general practitioner, and you can choose which one you want to go to in your area. You sign nothing. They simply have your name and address. And you're seen by that doctor. If there's something that is required, you're referred to a specialist. Where I live in London, I'm surrounded by 5 of the world's major teaching hospitals, all of them run by the National Health Service. And the way the National Health Service is represented in the United States is truly scandalous. That word socialist is pulled out. It's kind of infantile almost. Yes, it's socialist. If socialist is caring for the majority of the people and taking away the fear of being denied health care that so many millions of Americans have, they have this fear, then yes, it is. It's a vast community operation that is highly imperfect. Especially, it doesn't provide enough care for the mentally ill. It doesn't provide enough care for the aged. In some parts of Britain, outside the major urban centres, it's not as good as it is if you, say, go to London and you're near a great teaching hospital, as I am. But it's bereft of the kind of bureaucracy that means tests anyone coming into it. I don't sign anything when I go into hospital. I do sign when the doctors want to do something to me. You have to sign a waiver, so that you understand it and all that. That's it. it is so much part of people's lives that one of the most conservative medical organizations, or at least it was in the world, the British Medical Association, are the greatest champions of the National Health Service. Most of the research is done within the National Health Service. Why can't there be something like this? Not exactly the same. In fact, it could improve on it. The same, France has the same, Italy has the same, Holland has the same. What is it about US legislators that they appear to be so in bed with such powerful interests, such as the insurance companies,